Hi YouTube. Today I wanted to talk a little bit about trauma, the definition of PTSD, which stands for post-traumatic stress disorder. And I'm going to just kind of list off some of the criteria that might mean that you would fall under this category, and then talk about some kind of options for treatment or things that maybe you can do if you had PTSD to help you cope with that. So, in the DSM-5, which is our Diagnostic and Statistical Manual of Mental Health Diagnoses, the identification of PTSD is basically listed as the exposure to actual or threatened death, serious injury, or sexual violations. So things like sexual assault, molestation, those types of things. The exposure must result from one or more of the following scenarios. So you either have to witness a traumatic event directly, you can witness a traumatic event in person, so that means that it happens to someone and you're present for that. You can also learn that a traumatic event happened to a close family member, a close friend. It can happen like close by to where you are, or just really hit home in terms of being in your community or your school or something like that. There's also experiences firsthand repeated or extreme exposure to aversive details of the traumatic event. So that can be even in professions like mental health, nursing, social work, when you are like a first responder, police, those types of professions are at risk for developing some trauma and maybe some PTSD symptoms over time. And so in order to kind of classify under this criteria, the DSM says that the disturbance, regardless of what the trigger is, causes clinically significant distress or impairment to the individual's social interactions, capacity to work, or other important areas of functioning. It is not the physiological result of another medical condition, medication, drugs, or alcohol. So it is directly related to kind of triggering memories of a very traumatic or even life-threatening event. So the DSM kind of pays more attention to the behavior symptoms that come along with PTSD. And so there are 4 categories that it outlines, and they are re-experiencing, avoidance, negative cognitions and mood, and then arousal. Re-experiencing is kind of like spontaneous memories of a traumatic event. If someone has like recurrent dreams, nightmares, and is kind of reliving the event often in their dreams. Other ones are things like flashbacks. So flashbacks can be triggered by kind of anything that reminds us of the event, even words, smells, situations. Avoidance refers to as kind of avoiding certain situations, to not have to deal with kind of memories or triggers. So we don't really want to re-experience negative memories, thoughts, feelings, anything that kind of reminds us of what happened or what we have witnessed. Negative cognitions and mood can fall into a lot of different categories. They can be quite persistent, so almost feeling like we don't have control over them. We may have a really kind of distorted or warped sense of other people, safety, not feeling safe in certain places, really feeling like we blame ourselves or other people for what may have happened to us. Negative cognitions and mood can also mean that people withdraw socially, they don't participate in events that they usually like, those kind of things. And sometimes as well, there are aspects of PTSD that cause us to either kind of black out or not fully remember memories, and that is to do with how traumatic memories are stored in our brains, so they are not processed properly, and you may have heard of this as kind of getting stuck in a place of trauma. Arousal kind of fits in some of these other categories as well, but it can be marked by kind of aggressive behavior, reckless behavior, just having a really overactivated nervous system, being hyper vigilant and hyper aware of situations and people that are around us. And this is kind of like our fight or flight, which I have talked about in anxiety videos. So this is kind of a common aspect of anxiety as well, but with PTSD, the anxiety accompanies these other kind of three categories of behavior and being affected by trauma. The DSM for diagnosis requires that someone has persistent symptoms for over a month, and they kind of fall into those clusters of personality and behavior. If you are suffering with PTSD, there are some things available. Usually, you will need kind of more long-term counseling because PTSD involves needing some help processing memories, processing trauma that has happened to us that we just are not able to fully comprehend in our brain and our body. It's our sense of safety has been completely thrown off, especially when we've had a life-threatening situation happen. You're going to need some help processing that. Now, if you're not someone who likes to talk, there are therapies available that involve not having to do that. And one really good one is EMDR, eye movement therapy, and it is a way of helping to process trauma. There are some thoughts that sensory therapies as well can help with the processing of trauma. The main thing is if you're not ready to get into your trauma, you're finding that you're burying it, you might find that it will come up at times. You will still be triggered at times in your life, and there will be moments when you will have kind of these recurrent symptoms from the four categories that I talked about. So be aware that trauma doesn't necessarily go away unless we kind of make an active effort to help it go away and to help process it. But it's also really important not to get into that until you're ready, until you have a good therapist, someone who can really help you deal with some of that trauma and talk about it or process it in a way that's sensory. If you have PTSD or if you're around someone with PTSD, it's not their fault, and it's not your fault if you are having these symptoms. The most important thing is to remember that the things that happen to you are not things that maybe you could control. Do not blame yourself for what has happened, but in order to move forward with your life and move past it, it's almost like we have to move these memories out of the place in our brain where they get stuck, in our amygdala, in our processing center, and help to kind of realize that we don't have to live in the past, in the present all the time. So if you have PTSD, if you have questions about PTSD or trauma, you can also comment below. You can send me a message. You can also message me on Instagram. Instagram is YouCounseling, and I also have a website, www.youcounseling.com. So please let me know, like I say, if you have questions, concerns, subscribe to my channel, and I will see you next week.